everyone, and thank you so much for joining me today. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds, and today I'm going to teach you how you can help your patients or clients save on their healthcare expenses. Before we get started, I just want to go over a few things. You can feel free to ask questions at any time by typing them into the questions section of your GoToWebinar control panel. Just know I will reserve answering questions until the end. If I don't get the chance to answer your question, I will follow up with you via email. Also, I will provide my contact information and the contact information for NeedyMeds at the end. This webinar is being recorded and will be available for viewing on our YouTube channel. And you can find a copy of the PowerPoint slide deck in the handout section of your GoToWebinar control panel. So let's get started with what is NeedyMeds. This slide covers our mission statement and how we achieve our mission. But simply put, NeedyMeds is a national nonprofit that connects people to programs that will help them afford their healthcare expenses. And we do this free and anonymously through a website, needymeds.org, and a helpline, 1-800-503-6897. And one of the most popular and effective ways we help people save on medications is with a robust database of prescription assistance programs. Prescription assistance programs are programs that are usually supported by pharmaceutical companies and most of the time offer free and some of the time offer deeply discounted prescription drugs, usually name brands, to those who qualify. Of course, not every drug will have a prescription assistance program, but when one is available, the eligibility requirements and applications will vary from program to program. One common requirement is that the patient's healthcare professional usually needs to be involved by providing the prescription, signing the application, and submitting documentation. So how do you find prescription assistance programs and other healthcare cost savings resources on the NeedyMeds website? Well, bear with me while I transition out of the PowerPoint and onto our live site so I can demonstrate. So here's our home page. One quick point before I move into prescription assistance programs. I mentioned that this webinar is being recorded and will be available on our YouTube channel, and you can find that on the top right hand of our home page with the rest of the social media icons. It's the third one from the left. And we do hope that you subscribe. Okay, so returning to prescription assistance programs. You see at the very top left hand, there's a drug search bar. You can always begin searching if there is a cost savings program available by typing in the name of the medication here. To specifically find a prescription assistance program, let your mouse hover over that patient savings tab. And as you can see, a whole bunch of other categories pop up. Those are all the other ways that you can help your patients or clients save on healthcare expenses. So as you can see right at the top, on the left-hand side, there's a category dedicated to prescription assistance. And you can search a number of ways. You can search by the company name, by the program name, and probably the most common, by the brand name. Let's say you're looking to help a patient or client afford the name brand drug Eliquis. I'll choose that hyperlink, and then what happens is a bunch of icons pop up. What these icons do is they show you what type of information is available for that drug. Is there a cost savings program, like a prescription assistance program, or a coupon available? Is there more information available about that medication, which you can find through support pages, for example, which provide hyperlinks with further details about that medication? Is there a drug video available, which is exactly what it sounds like, a short video offering information about that drug? You'll also notice this A to Z index. Many of our large databases have this to make your search easy. So let's return to our search for Eliquis. Obviously, I'll choose the letter E in the A to Z index, and once I do that, I'll scroll down the long list of medications to see if the medication I'm looking for is there. When you find it, click on the hyperlink, and there are those icons again. some that would provide more information about Eliquis, including drug videos or support pages. There's also a coupon available, but the icon on the far left indicates that there is at least one prescription assistance program available for Eliquis. So I'm going to go ahead and click on that hyperlink. And what pops up is what we hope you'll agree is the most important information about this prescription assistance program. Don't worry about reading that text just yet. I wanted you to get a sense of how the page is set up and all of the information that is provided. So I'm going to make that screen a bit bigger so we can talk about all of those different categories. One other thing I want to point out, currently there is only one prescription assistance program available for Eliquis. If there was more than one, it would say one of two, one of three, for example, in this blue bar at the top. And when there is more than one, the program that offers the most assistance would be listed at the top, and then the ones that offer less assistance would be listed at the bottom. So really importantly, right at the top, you see the name of the supporting organization and their contact information. And that's important because you're going to want to be sure to direct all questions about the program to the contact information provided in the program directly, as opposed to NeedyMeds. Underneath that, you'll find the application section. Most often, you will find a hyperlink, like in this case, to the application. And underneath that is the medication section. The medication section lets you know where you can find where all of the medications covered by this prescription assistance program are listed. And of course, each program will list an eligibility requirements section. As I had said in the beginning, although eligibility will vary from program to program, it is almost always based on three factors: insurance coverage, income, and residency. So let's talk about those three things. You'll notice in insurance status, in this instance, it says the individual must not have prescription coverage. That certainly is common, but don't assume that just because your patient or client does have insurance or drug coverage that they won't qualify. Again, the eligibility requirements will vary from program to program, so it's worth checking out. Eligibility requirements also often require income. And often the income requirements are based on a certain multiple of the federal poverty level. And because that's such a common requirement, we put a handy federal poverty level income calculator right here. I want to demonstrate so you can see how easy it is. Let's say you have an individual whose annual income, as you can see, I use this example often. This individual makes $47,500 a year, supporting a family of three. Now, a couple of quick things. You'll notice I only typed in the digits. Do not type in periods, commas, or dollar signs. And this is the same figure that the individual will use when they do their taxes. So that's all the information the person would need. Simply click, calculate, and the results indicate that this individual's yearly income is 222% of the federal poverty level guidelines. Now, when we return to the eligibility requirements section, you can see that this individual clearly qualifies, which is great. But what happens if the calculation showed that this individual wasn't eligible? Maybe they found themselves just above the eligibility requirements at 305 or 310%. When that happens, we actually recommend applying anyway. Oftentimes, if it's close to the limit, they will accept the application. But if the individual is denied, they can always call the program and ask them to make what's called an economic hardship exception. And if they don't have that luck, they can always appeal. So we talked about the income eligibility requirements. Let's talk about also the residency requirements. Again, don't make an assumption here that if you're working with a population that is undocumented, for example, that they will automatically not be eligible. Be sure to check out the residency requirements where we will provide the detailed information for each program. And of course, if you're unsure what type of residency verification is required, you can always call the program directly. Do be mindful of the application section. This has information about if or how the doctor needs to be involved and the time frame in which to expect a decision. Underneath that, you'll find the medication section. And this is important because it lets you know details such as where the medication will be sent to and when the medication can be expected. And that's important because you don't ever want to put your clients or patients in a position of missing their medications. And it also lets you know the details for reapplying. Be sure to always check out the additional information section. Now, there's nothing listed here in this example, but oftentimes we will put other pertinent information that does not fall neatly into the other categories. Now, applications can often feel complicated, and you and your staff may not have the time to assist your patients or clients. So we've put together, again, returning to that patient savings tab, a database dedicated to help with prescription assistance applications. This directory will provide a list of usually nonprofits that will help people apply to prescription assistance programs, usually for free or for a very nominal fee. And as you can see, you can search in the area narrowly by zip code or by state. Now, before we move on from prescription assistance programs, I want to point out our PAP Tracker software. And you can find that under the Advocates tab on the left-hand side. If you and your staff do help with prescription assistance program applications, or you're interested in doing so, sometimes these applications can take up quite a bit of time. That's why we created PAP Tracker, which is a software that eliminates the administrative burden of having to manually track and submit applications. If you're interested in learning more about PAP Tracker and receiving a free demonstration, you can go ahead and shoot me a message in that questions section of your GoToWebinar control panel. So let's move on to other ways you can help your patients or clients save on their healthcare expenses. I'm going to go ahead and let my mouse hover over that patient savings tab. I want to speak with you about that $4 generic discount drug program on the top left-hand side. This is a directory of all discount programs for generic medications available at major retailers. Now, although it's called the $4 generic discount drug program, most will range in price from between $4 and $15 up to a 30, 60, or 90-day supply. Like the other databases, there's a number of ways you can search. You can search by state. You can search to see if there's a specific drug the individual is looking for assistance affording. You can search for a particular store or pharmacy. But to keep things simple, I'm just going to do a basic state search. So let's go ahead and see what's available in, let's pick Michigan. That's all I have to do. Click on that. And here are the results, which indicate that there are currently 15 pharmacies or stores in Michigan participating in the $4 generic discount drug program. And I hope you'll agree that all of the pertinent information is now on your screen. The far left-hand column is the store name, as well as a hyperlink to that store. The center section is the name of the program, and on the far right, that program column will let you know exactly what your patient or client will be able to save. Now, as I said, most do range between $4 to up to $15 for a 30, 60, or 90-day supply, although it can vary. And sometimes the estimated savings is calculated by a percentage as opposed to a dollar amount. So again, if you have any questions, you can go ahead and submit them anytime into that questions section of your GoToWebinar control panel. So let's keep moving on. And the other section, which is another really popular destination on our website, is our free, low cost, and sliding scale clinics database. In fact, this database just last year, in addition to providing you with medical and dental clinics, we've also broken it down so you can help your patients or clients if they're looking for a mental health clinic or a substance addiction clinic. Now, these are all set up the same way. So for purposes of demonstration, I'm just going to go ahead and click on that medical clinics hyperlink. And as you can see, it really is a robust database. We have more than 16,500 free, low cost, and sliding scale clinics in our database. And these are really good options. Maybe you are a doctor or you work for a doctor's office, so obviously your patient is getting the care they need. But being aware of the clinics in the area is also important. Maybe they need to be treated by a doctor on an hour of operation that you're not at your place of work. It's good for them to have an alternative to an emergency room if it isn't necessarily something that needs to be treated in an emergency room, but maybe it can't wait until their regular doctor has returned to work the next day or on Monday. It's also important because although your patient may be able to be treated with you now, life situations change. They may relocate, their insurance may change, or they may have a family member, a loved one, or a neighbor that is looking for a clinic in their area. And more importantly, they may have access to a medical clinic or a doctor, but maybe they're looking for a dental clinic or a mental health facility or substance addiction. So this is a good database to have as a resource. Like the other databases, there's a number of ways you can search, but since this one is so large, I'm going to do a more narrow zip code search. So all I'm going to do is type in to see what clinics are available within 5 miles of that 9006 zip code. And the results yield there are actually 71 clinics within 5 miles of that zip code. And again, the results will provide all of the pertinent information that you'll need. At least I hope you think so. And the reason I keep saying that is really we do consider all of our users of our website partners, and especially healthcare professionals. So please do be vocal about your experience with our website. Are you finding what you need? Be vocal about that. We'd love your feedback. So what you're looking at on your screen is all of the pertinent information about that clinic. You'll see the clinic name, contact information, and hyperlink to the website if one is available. The eligibility requirements, the eligibility column basically lets you know who can be treated at that clinic. And it lets you know other details such as what fee can the patient expect to incur, and does the staff speak other languages, which can often be helpful. The right-hand column provides further details about the services they include. And we do include the hours of operations, and although we pride ourselves on the information being accurate and up to date, we really recommend that you reach out to the clinic or visit the website before you recommend your patient or client head out that door. A really great option here is the printing options. Let's say you wanted to provide your patient or client with this list of all 71 clinics. You can choose that print all option and it'll do just that. Or you can narrow it down by clicking the box on the left-hand side, choosing only the ones you think your client would be interested in, and choose that print instead of the print all option. And it'll do just that. It will generate and print a list, including only the ones you choose. So another important database under the patient savings portion of our website, let me make this a bit smaller, is our coupons and rebates database. And I'm on the bottom left-hand side if you can see my mouse. This is where you can find prescriptions, over-the-counter medications and supplies for which there is a discount, a free sample, a coupon, a rebate, a trial offer. Like the other databases, there's a number of ways you can search. You can search by the name of the drug, by the name of the product, But in this case, you can also search by category, which, as you guessed, means medical category. And then you can see the alphabetized list. I'm going to go ahead and just click on blood pressure so you can see what the results yield. The helpful thing about the coupons database is there are those icons again. So what that means is if you do find a coupon for a particular medication, it will also let you know if there's another cost savings program available, like a prescription assistance program. And it'll let you know again whether or not there's helpful information about that product or drug by support pages or drug videos. We actually just updated the way our coupons database is listed. We used to just have a paragraph of information, a little bit difficult to read, or that's the feedback we got from our users. So instead, we broke it down into a bullet-pointed list, and we always put a helpful link to the manufacturer's offer website if anybody has additional questions. We also put a convenient way to have the NeedyMeds drug discount card printed out, emailed, or texted from here. And of course, later in the presentation, we'll cover how the NeedyMeds drug discount card can help your patients save on their medications. So at this point, hopefully you're seeing that the NeedyMeds databases are set up similarly. Obviously, that's purposeful. We want to make the website as easily negotiable as possible so you can find what you need with a few clicks of your mouse. I also want to point out, don't hesitate to simply refer your clients to us by having them call 1-800-503-6897. And we can do all of this work for you and help them out as quickly as we can. And we also do have Spanish-speaking counselors. So now, aside from the prescription assistance programs, the second greatest source of savings under that patient savings tab is with our diagnosis-based assistance programs, and that's in the center. Diagnosis-based assistance programs provide financial assistance for costs associated with a particular diagnosis. So now this database is different because for the most part, it doesn't include medicine. What it does include instead are other necessary, special medical expenses. Let's say somebody needs help affording supplies, medical equipment, testing supplies, or even maybe they need help affording things like a wig or house cleaning services or assistive technology. For those types of expenses, you would check out the Diagnosis-Based Assistance Programs database. Like the other databases, you can search pretty narrowly and a number of different ways. For example, you can search by the program name, which is probably one of the least common. You can see what's available in your state or nationwide. And what that means is programs by state, meaning you have to reside in that state to be eligible. Nationwide means you can reside in anywhere in our country to be eligible. But you can also search by diagnosis. And because this database is pretty robust, you'll find that easy A to Z index. And I'm going to go ahead and click on D for diabetes. I like to use diabetes as an example because not only is it so commonly diagnosed in our country, but it's also an example of a diagnosis that requires a lot of expense, oftentimes, in addition to medication. As you can see, because it's a large category, it's broken down into a number of subcategories. But for the purposes of this webinar, I'm just going to click on the general hyperlink for diabetes. Currently, there are 65 diagnosis-based assistance programs for diabetes, and like the other databases, here's a snapshot of what these programs provide. On the left-hand column is the program name and a hyperlink. The next column, you'll see a summary about what that program is, and most importantly, the far to right corners will let you know the services the program provides and the area of service. And again, that means where do you need to reside to be eligible for the program? As you can see, the services provided are oftentimes medical supplies or assistive technology, but it will vary from program to program. For example, this one offers help with respite care, and this one will help a patient get access to a service animal. You'll notice the column on the far right side, it says national. That's because we list all of the national programs first, and then the rest of the programs are listed alphabetically by state. Now, since I use diabetes as an example, and as healthcare professionals you know, oftentimes diabetics are required to self-inject, which is why I want to take a moment to point out the link to our safe needle disposal website on the left-hand side. As I'm sure you know, there are limited options for proper disposal of needles and sharps, which can lead to dangerous situations for the public. We hope you will partner with us in educating the public about safe disposal for all at-home sharp users. Directing them to this website, we hope, will prove useful. Now, since it's right above that, on the left-hand side, I also want to point out this box talking about Be MedWise. We are very proud to now host the Be MedWise website, which has up-to-date and accurate information on promoting the safe use of medicines. And you could just get a sense, look at all the helpful information, for example, that pops up under using prescription medication safely. So again, we do hope you will find this to be a useful resource for your patients and clients. Also, as healthcare professionals, I do want to take time to point out that you can find, once again, remind you can find under that Advocates tab that PAP Tracker Software, and that's on the left-hand side. Okay, so we were talking about finding assistance based on diagnosis, so I want to point out a few more databases. Under that Patient Savings tab, right at the top, you will find a database dedicated to diagnosis information pages. And these are exactly what they sound like. Let me make the screen a little bit smaller. These are educational pages dedicated to specific diagnoses. Our goal is to partner with other reputable nonprofits to provide the most accurate and up-to-date information about a particular disease. As you saw on the landing page, the diagnoses are listed alphabetically. I don't want to spend too much time here. I just wanted to make sure you knew about this destination, especially if you have a patient or a client that's newly diagnosed. We also have databases dedicated to medical transportation, for example. We recognize that getting to and from a doctor's office or specialized facility can be a burden. So we've put together a directory to help people with their medical transportation needs. We also have databases dedicated to camps, retreats, recreational programs, and educational scholarships. And those are pretty self-explanatory as they list camps and scholarships available for people living with a specific diagnosis. I also want to point out the government program section. Now, this obviously has all programs that are available per state, but if you work with the senior population, this is also a good destination because it includes pretty exhaustive Medicare and Medicaid information. So now bear with me while I transition out of the live site back to our PowerPoint presentation so I can talk to you about how to use the NeedyMeds drug discount card to also help your patients or clients save on their medications. So as I'm sure, before we move into that, the screen you're looking at is just the resources we've covered. And again, you can find a copy of this PowerPoint slide deck in that handout section of your go-to webinar control panel. If you have trouble downloading it, just shoot me a message. I'll be happy to forward it to you after the presentation. So as healthcare professionals, I'm sure that you're aware that there are a bunch of other drug discount cards out there. So what is different about NeedyMeds? So most importantly, I would say that the NeedyMeds drug discount card is not only free, but it's anonymous. We do not collect people's personal information. The NeedyMeds drug discount card requires no registration, no enrollment, no residency, and no activation. Our drug discount card can be used for prescription medications, over-the-counter medications as supplies, as long as they're written as prescription, and even to save on your pet meds, as long as you pick them up at a People pharmacy. Let me know if you want to learn more about that. You can send me a message again in that questions section. With the NeedyMeds drug discount card, users can save between 0 and up to 80% off of the cash price of their medications. A few other things to keep in mind. Not every product is discounted, and our drug discount card only works at brick and mortar pharmacies. It is not accepted online. I'm happy to let you know that when the card offers a discount, 85% of the time it is presented to the pharmacist, and it's an average of half off the cash price. So really importantly, who can use the NeedyMeds drug discount card? Well, the simple answer is anyone. The only rule is it cannot be combined with insurance. So if someone is uninsured, they can use the card anytime. If they do have insurance, they may choose to use the card instead. And they may do that maybe, for example, if their medication isn't covered under their particular insurance, they may find themselves in a coverage gap, or maybe they have a high copay or high deductible. So let's return to the website so I can demonstrate where you can get drug discount cards and how to maximize tools for savings. So bear with me. So as you would probably guess, there are a number of ways you can get to that NeedyMeds drug discount card page. Under that patient savings tab, there's a couple of links, one on the top left-hand side, one on the bottom right-hand side. But right on our home page, you can see that box on the left-hand side with that arrow. All of these hyperlinks will take you to this page. You can direct people here, and they can print out our downloadable PDF. They can fill out a form, choosing a design. Probably the least convenient thing they can do is send us a self-addressed stamped envelope to our P.O. box. And of course, they can give our expert call center counselors a call, and we can drop one or a supply of them in the mail. Now, again, you can certainly direct folks here, or you can keep a supply of drug discount cards on hand. And if you are interested in receiving a bulk supply of our drug discount cards or our educational brochures and materials, you can reach out to me, or you can drop my colleague Alana an email at alana@needymeds.org. And of course, I will remind you of our contact information at the end. Now, at the bottom of this page, you'll also find the really convenient pharmacy search. And this will let you know what pharmacies accept the NeedyMeds drug discount card. And the chances are there will be at least one in the area where your patient or client lives, because the NeedyMeds drug discount card is accepted at more than 67,000 pharmacies nationwide. So I'm going to do a narrow zip code search so you can see what the results yield. And here's a list of 27 pharmacies within 5 miles of the 80906 zip code. And again, if you wanted to share this with your patient or client, you can print the list. You can direct them here, or you can have them reach out to our expert call center counselors. And again, we hope you'll agree that all of the pertinent information is on your screen now. The name of the participating pharmacy, their address and a phone number, and even a map, so the person doesn't have difficulty finding them. So now let's say you've provided your client with the NeedyMeds drug discount card. You've directed them to the pharmacy search, so now they know what pharmacies in their area accepts the drug discount card. The final step is, how much would the medication cost using the NeedyMeds drug discount card. And to find that out, you can click on the drug pricing calculator or drug pricing tool on the left-hand side. To find out how much that medication will cost, you'll need 4 pieces of information: the pharmacy zip code where they would like to pick up their prescription, the prescription name, the dosage, and the day supply, meaning is the prescription for 30, 60, or 90 days, for example. Of course, if you don't have the time to do this or your patient doesn't have access to the internet, you can have them reach out to our call center experts who can find out all of this information for them. The idea is that with the pharmacy tracker and the drug calculator, we'll be able to help your patients or clients find out where to pick up their medication and how much they will be paying before they head out the door. 2 other things I want to cover related to our drug discount card. If you're interested in NeedyMeds creating a drug discount card with your organization's name and logo, we can do that free of charge. Check that out under the Advocates tab. On the right-hand side, you'll see a hyperlink for drug discount card partnerships. What this means is we can provide an unlimited supply of plastic cards as well as a PDF to include on your website or share electronically. This also comes with a complimentary monthly report letting you know how many times your card was used and the dollar amount of savings afforded the user. So again, send me a message if you're interested in learning more about this, or if it's easier, just return to the drug discount card partnership on our website to learn more. One other quick thing about our drug discount card, on the left-hand side, you'll see a hyperlink to what is called Health Storylines. Health Storylines is a free self-care app that makes it easy for people to track and manage their health conditions and even the health conditions of their families. And it does come loaded with the NeedyMeds drug discount card app. And again, this could be downloaded for free and can find it on the Google Play app or the App Store. So now I'm going to go ahead and transition back to our PowerPoint presentation. So bear with me while I do that, because what I wanted to review with you are the ways that we hope that NeedyMed can assist you in serving your patients. The easiest and simplest thing to do is simply being aware of NeedyMeds and directing your patients or clients to our website, needymeds.org, or a helpline, 1-800-503-6897. If you have other colleagues interested in learning about NeedyMeds, you are absolutely blown away by my presentation and the resources we have, I would be happy to conduct a personalized webinar at your convenience. Again, just send me a message. Under that Advocates tab that I referred to a bunch of times, you can sign up to receive our newsletters, program update emails, print materials, and more. So we do hope you take a moment to check out that Advocates tab. That's where you can also register for other upcoming webinars. Now, under that Advocates tab, you will see a link to something called our Patient Assistance Resource Education, PAIR, course and exam, which is a web-based, self-paced tutorial on how to find healthcare cost savings programs on needymeds.org. We do provide a certificate of completion for those that finish the exam. And although we usually charge $15 for PAIR, it would be our pleasure to waive the fee for today's webinar attendees. And you know what I'm going to say, which is that if you are interested, you can send me a message in that question section of your control panel. A reminder that the PAP Tracker Software is here to help you alleviate that administrative burden of manually submitting and tracking prescription assistance program applications. And of course, simply distributing information about NeedyMeds will prove helpful to the population you serve. We can provide you with an unlimited supply of our most popular brochures. Trust me, they are not doing anyone any good sitting on our shelves. And again, we are happy to provide you with more information on getting your own customized drug discount card. I do see a bunch of questions coming in, and while I get to those, I wanted to leave up our contact information as promised. At the top, you see the contact information for my colleague Alana. Again, if you're interested in ordering drug discount cards or brochures, you can reach out to her. If you have questions regarding this webinar, you can email me directly. And of course, there's our toll-free helpline, which again is 1-800-503-6897. So I'm so pleased to see a bunch of questions coming in. I'll do my best to get to most of them. But if I don't, again, I will follow up with you via email. And of course, to everybody that participated saying that they would like to learn more about various resources I mentioned, I will get back to you, and I'll try my best to do that by tomorrow. So let's get to some of those questions coming in. Here's a great question, and one we get asked regularly, which is how does NeedyMeds support itself? Well, we are a nonprofit organization, and like other nonprofits, we do rely on corporate and individual donors as well as grants. A few other ways that we do get financial support is that we provide license fees for organizations' use of our databases. That PAP Tracker software is not free. It's actually the only thing I've mentioned through this entire webinar that is not free, but we do get a stream of income from the sales of that PAP Tracker software. But one thing I really want to stress here is I am not trying to sell you a PAP Tracker software. My goal with bringing that to your attention is simply that if your staff time is being taken up by manually tracking and submitting prescription assistance program applications, I just want you to know that there are resources that can help you to eliminate that administrative burden. PAP Tracker software is one of those resources. Check it out. Let us know if you want a free demonstration, but by all means, shop around and see what else is available to you. And again, we're just making sure you're aware that there is something that can help eliminate that administrative burden. We also do get a small transaction fee for every use of the NeedyMeds drug discount card. We have thoroughly reviewed supporting partners on our website, and we do get fees from pharmaceutical companies for call center and application processing services. So another question coming in is, in the beginning, you mentioned you can use the drug discount card to save on pet meds. How? Well, actually, we did put together a less than 10-minute video on how to use the NeedyMeds drug discount card to save on your pet meds. So you can go to the NeedyMeds YouTube channel and type the word pets into the search bar, or you can send me an email, and I would happily respond by providing you with a link to that video. Here's another question. Can people with Medicare Part D apply to prescription assistance programs? Well, although I hate to give this answer, the answer is it depends on the company. Some will let you apply. Others will determine that on a case-by-case basis. And you will see the answer to that question in the eligibility section of the Prescription Assistance Program listing on our website. Oh, here's a great question. What time is the NeedyMeds call center open? Thank you for asking that. Our call center experts are here from 9 to 5, Monday through Friday, but do keep in mind we are located in Massachusetts, so that's East Coast time. So I do like to keep the question segment brief. If I didn't get the chance to answer yours, I will be in touch via email. In the meantime, thank you so much for taking time out of your busy schedule to learn more about NeedyMeds, and we do hope you stay in touch. Thanks again, and have a great rest of the day.